Okay, I am Mayuri Panditrao, and that's Prashant Jeevan. Tahir is not here because he's actually half the way across the globe. He's in London right now. And on his way to India, we will be working in India this summer. And we start work next Monday. So our project is GIS-based prediction of vector-borne diseases. We'll just tell you a little bit about what we're doing this summer and what our whole plan is, what we've mentioned in the white paper and what we plan to do. So just a little introduction about myself. I'm from the School of Public Health, Prashant is from EECS, and Tahir is from the School of Public Policy. So it's a multidisciplinary team, and we plan to come this together.
You play more?
Do you know it? I don't know, it's not on.
Just click. You go to the...
It's not. Thank you. Okay, so just an overview of what we're doing. In disease control, basically we say that prevention is always better than cure, and treating cases is always very, very expensive. And that is the hallmark of public health, actually. And precise targeting is one of the effective ways of saving these costs caused by disease to the economy of any country. So precise targeting can be achieved by using GIS, which is Geographic Information Systems, and it can be used to actually find out what areas are at a high risk of getting disease. In our case, we're going to study malaria. It's a vector-borne disease caused by the female Anopheles mosquito. And in India, the case of malaria, well, it's pretty bad. We have about 1.5 to 2 million cases every year. And these are government numbers, so the actual number of cases are pretty high. And it's very, it's an economic burden to the country because it's 577,000 DALIs, which is disability-adjusted life years, and it's pretty high for India. The preliminary studies have identified there's a lot of literature on this, and we've all come to the conclusion that something needs to be done, and probably GIS is one good tool to find a prevention method for malaria.
So GIS, or Geographic Information Systems, is basically like a database. Geographic Systems, or GIS, is basically a database, but instead of viewing numbers, you're viewing the numbers in terms of maps. And you combine these maps as a figure shows to make decisions. And like any IT system, basically, if you have garbage data in, you'll have garbage data out. So the predictive power of GIS is something we'll validate, but more importantly, we need to get the data from the nationwide, all of local areas, to the national health centers, to the systems that perform this GIS software. For our specific project, we'll be focusing on rainfall, altitude, soil porosity, temperature, and water bodies to predict where the malaria mosquito will be going. It's been used before for disease outbreaks in Africa to predict helminthic or worm-borne disease outbreaks. So this is, like I said, the technology of GIS isn't so new. In fact, it's been around for 30 years. To leverage the IT strengths of India, we will be meeting with private sector IT experts and try to talk about what are the problems with our approach, because these are the experts and we don't think we know the complete solution to our problem. And also to discuss government-private sector collaboration. And like I said, GIS needs a nationwide infrastructure, so there's data from the public health centers, they'll know who's being infected, and they'll know it first. And so to get it to the national health centers in a timely manner is important.
Okay, why UC Berkeley? We all know that UC Berkeley is very diverse, and we have multidisciplinary people on campus, and we want to really use that advantage and use the advantage of strengths in database, in GIS, in remote sensing, in image processing. And what we really want to do is to take all this and to take the research that is happening on campus in infectious diseases and the international network and focus on campus to put this all together and actually build a platform so that we will be able to do more of this kind of work internationally. And
so in summary, we want to validate GIS disease-based prediction with malaria in India. and talk to IT experts and government officials to assess the feasibility of our approach and also for collaboration. And we want to create a platform at UC Berkeley because multidisciplinary and international problems are the name of the game at Berkeley, and so we need to do that.
And last but not the least, we really want to thank all our professors, Art Reingold at the School of Public Health, Drew Isaacs and Christy Robbie, and Theogene Rudasinghe, who are at House School of Business, and Dr. Aruna Srivastava, who is our main contact in India, and we're going to work very closely with her this summer, and fellow colleagues at the Bridging the Divide conference and the teams for their constructive input. So, thank you.
So we just signed an agreement with the Department of Science and Technology in the ministry in India
Okay.
explicitly for projects like yours. And so the way this project is set up is it funds people in India, research institutions in India that will mirror the work that you do, except when they send visitors to work with you, and when that happens, they're able to send money with those visitors to work with you.
Wow.
And I'll give you, there's a ongoing RFP process.
Okay.
It's actually a decent amount of money a year. And so I'm happy to give you the contacts for, so it's a UCOP, it's all the UCs,
Right.
but certainly CITRIS is a signatory to it. And this actually holds for everybody. If there's such an agreement with, we're gradually going to do it with other places, but India was the first. There's one with China also, but there's no money to it yet. But the India one has money attached to it. So even though it won't be money for you, it's money to spend on the Indian side, except when they come and visit you. So I'm going to give you the contact.
Sure.
Sitting next to me here.
So this is like a link to the research institutions in India?
Yeah, so it's a proposal competition. So someone from India has to be a lead to submit a proposal to them. That gets reviewed and then they get funded. So, it's a competition like this.
Thanks for that answer.
I worked on a project with the World Health Organization a number of years ago. The CIO there was the one who set up one of the Helmintic projects with the worldborne diseases.
Right.
His name is Salam Mandil. He may be a good resource for you to look at ways of working in India, which oftentimes is a big problem.
Right, in our research over the semester, we actually found out that WHO has like a kind of a package almost that they try to apply to developing countries.
Right, and it comes complete with equipment and money, so it might be a pretty good person to help you unlock some of that.
Thank you.
So that's Ravi Namana. He used to be at Health Tech Center. So he himself is a resource for
Great.
you, I think.
But Salam Mandil was under the International Telemedicine Resource Center that we formed at Davis a number of years ago. So he's,
Any other questions or? Okay, thanks.